healing of our nation as a whole. Sip a cup of tea, wear your favorite turban, tee, or tunic, and enjoy tea time with Shebrew royalty.
Shalawam, shalawam, everyone. Shalawam, sisters, come on in. Come on in. Come on in with your beautiful royal selves. Come on in. As you come in, please do me a favor. Hit the like button, share, subscribe, hit the notification bell if you haven't already done so. We are getting ready to go live to let everyone know that we are live right now. Let everyone know that we are live because tonight we are bypassing all of the housekeeping stuff, all of the disclaimers, and we are jumping right into this show tonight. We have a very, very special guest tonight. And yeah, I want us to go ahead and get started immediately. But before we go any further, as we do every single week, the first thing that we do is what? We give a mighty praise to the Most High God. AHAYAH, AHAYAH. I am that I am. The God of the Hebrews, the God of the Shebrews. I am your hostess, Kwala Yakaka, and I humbly thank you for being here on this broadcast with me tonight. So thank you all for being here. Thank you for being here. Come on in, sisters. Let us get this royal tea party started. Come on in. Let's see who's here so far. We have Sister Carla. We have Sister Simone, Sister Johnny. Any other sisters out there, just give me a thumbs up. Let me know that you're here. Let us get started on this broadcast. Let us get started. I had a beautiful week. Did you all have a wonderful week? Did you have a great week? I certainly did. And this is definitely the best way to start the new week, right? Welcome to April. Tonight, we are kicking off alternative and complementary therapies and treatment month with a very special guest, Dr. Michael Williams of Upper Cervical Chiropractic, Upper Cervical Chiropractic here in San Antonio. So he is my special guest tonight that I am going to bring right in because we want to get this show started. We want to be respectful of his time. So let's get this show started right away. Let me bring my special guest, Dr. Williams, in. Come on in, Dr. Williams. Hello.
Hello.
Can you hear me okay, Dr. Williams? Can you hear me okay? Your video has is frozen. Oh wow, we lost him. Let's give Dr. Williams a minute to come back in. Let's give him a minute to come back in here. And Dr. Williams is actually my chiropractor. And I'm so very grateful that he agreed to come on tonight to educate us on this very specialized area of chiropractic treatment. So let's get Dr. Williams back in. Here we go.
Sorry about the difficulties.
No problem at all. Welcome, Dr. Williams. Welcome
Thank you.
Tea Time with Shebrew Royalty. Do you have a cup of tea?
I actually do, as a matter of fact. So
that's what I'm talking about.
I like it. Well, good evening. Thank you for having me this evening.
Of course. Thank you for coming. Thank you for coming. I am so grateful that you are taking this time to come and educate us on this very, very important special area of chiropractic treatment. So I would like for you to introduce yourself and also tell us about upper cervical chiropractic and about your clinic.
Well, first of all, again, having me this evening. I know we're all busy in this world, and it's important to come together and ground ourselves and stabilize ourselves in this world as well too. There's lots of things that are always pulling us away from these types of good events. So again, I encourage you to continue doing what you're doing, and I think you're doing an amazing job as well too.
Thank you so much.
Upper cervical and chiropractic. I want to tell you just a little bit about me and my story first, and then we can roll into upper cervical. I was 18, 19 years old. I was in the military. I was in the United States Coast Guard, and I started suffering really bad headache migraines. And so I did what everybody does, and I went to my medical doctors, and I sought help. And I noticed after a few years, the migraines kind of continued. And in fact, they probably even got worse. And I was having to up my medicine and do some different stuff. And so one evening I was out with some friends and I got a really bad headache. And it was one of those headaches where I needed a change. I needed something different. And so I reached out to some family members actually, and some family members recommended, for me to try something alternative. And at that point in time in my life, I kind of brushed them off. And I didn't really take what they had to recommend as something serious. So I continued on my route now. So I went back to my medical doctors and I said, hey, what are we going to do? These headaches are getting worse. And, my medical doctors suggested what they, that's, the medication route. And, so they said, we're going to, you'll take this pill every day and you'll take this pill when it gets bad and you'll give yourself a shot if it gets to this point. And I was just like, wow. I came to where I realized this wasn't fixing or curing anything. It was just covering up this repetitive problem. And so I wanted to dig a little bit deeper. And that took me down my road of chiropractic. And so I was fortunate, and my family recommended me to an upper cervical chiropractor. And I went and upper cervical chiropractor. He adjusted my neck, only one bone. And I had such immediate and crazy changes that, I actually went back and I had a couple conversations with this doctor, and I didn't understand it. And I couldn't figure out why all of a sudden I started having all of these positive changes in my life, including the headaches dissipating. And so he gave me a couple of books to read, and I dug into this and I got real into it. And basically going and seeing this doctor and actually getting my headaches treated and corrected and helped better than anybody else could do is what turned me into being who I am here today as well. So with that being said, I went down and I decided I was going to be an upper cervical chiropractor. So I changed my career path. I went back to school. I got my doctorate in chiropractic, and 13 years later, we're still up and running in San Antonio with our clinic. So, it's been an amazing ride. So
awesome.
So let's talk. I know we have a lot of time either, so let's get into the nuts and bolts. Let's talk about what is upper cervical, what is chiropractic.
Yes.
So there's a couple of different, in the state of Texas, we cannot call ourselves a specialist. This state does not allow ourselves to differentiate ourselves from any other type of chiropractor. But in my type of chiropractic, all I deal with for the most part is the neck, and all I really deal with is one bone out of the neck, where there's 24 bones in the spine and 206 bones in the body, where all of your general chiropractors are adjusting all of these other segments. As an upper cervical chiropractor, we're really only specializing in one particular joint or bone. And that's, kind of like in your medical field, like your cardiologist or your dermatologist or somebody that may specialize or may go into a different route. If you've got a problem in that area or that deals with a certain field, for me especially, I would like somebody that involves a lot of their time in that general field. And with today's state, unfortunately, with cell phones and technology and automobiles and our sleeping posture and our recreational time, a lot of this is putting us in a negative forward head posture position, which is really creating a lot of turmoil and with the way the neck is designed, the way that God designed the body or the curve in the neck to work and flow. And so again, upper cervical chiropractic is definitely something that we feel is going to be demanding or needed in the future, very needed in the future from all of our from everything that we're doing in this world. So, when we talk about the upper cervical neck, it's different from all of the other bones. And so the upper cervical neck is, when you talk about the other bones in the spine, they're connected together. And so they're connected together with a certain joint that really locks the spine into place and all rotate as one piece. Whereas when we talk about the very top bone, which is the atlas bone, it's different. It rotates, it pivots, and that's what allows us to do all this really motion. And that's what we can do with our head and our neck, is because we have this certain joint that allows us to do that. And it's designed differently. It's designed, let's talk about tea for a second. It's designed like a little teacup and saucer. And so it has a condyle that the head sets in. And so the head has this range of motion that it can use. And so if you've ever had tea and taken a drink of tea and you set it down into the saucer, and if you don't set it down into the saucer correctly, there you go, cheers. If you don't set it down correctly and the teacup rocks up to either side, that's going to create instability. And the instability is going to allow the teacup to possibly spill or fall or have more of a tendency to not be in the correct proper position. And the head is the exact same way. When the atlas bone, with all of the range of motion that the atlas bone allows us to do, it also means that traumas and accidents misalign this a little bit farther than it does the rest of our bones. And so that can cause some more problems as well too. And that can be.
Oh, wow. Oh, wow. Sorry about that. We apologize for the technical difficulties there. Boy, it was just getting so good. It was just getting so good. Yes, you are back, Dr. Williams. Let us bring you back in.
Sorry about
yeah, we're having a little bit of technical difficulties here. Sometimes it's even the voice is going in and out a little bit, and they're saying it's kind of blurry. On my end, it's not blurry, but your voice is kind of, the audio is going in and out a little bit there.
See if I can maybe move this a little. You may not get the best picture of me. Let's see. Is audio any better here?
I don't think it's necessarily the phone. I'm wondering if it's the Wi-Fi connection. If there's something going on there with the Wi-Fi. But go ahead. Yeah.
Well, listen,
this is good right now. I'm hearing you pretty clearly right now.
If it doesn't work tonight, we'll set it up and we'll do it again. Okay.
Oh, that would be great. So far, so good.
Where did you kind of lose me at last time? Did we talk? Did you lose me on the stability, or where did I drop off at?
We had just talked about the cup and saucer and the instability and spilling.
Okay. So the head has more range of motion than anywhere else in the spine. And so
Mm-hmm.
that gives us this awesome range of motion. But it also creates another factor that means there's going to be a greater chance of misalignment in that area due to the fact that we have more range of motion. So accidents and traumas can misalign the cervical spine a little bit more than they can some of the other larger joints in the body. Now,
Mm-hmm.
you say, well, okay, how is that important as well too? Well, the very next thing is the top bone, the atlas bone, also houses the brainstem. Okay. And so the brainstem is controlled, or the brainstem is compromised of over 450 million nerves. They quit counting around 450 million. That's
Wow.
where all of the nerves come down from the head, and they desiccate and they go to the rest of the body to make the body work. And so the brain, that's the highway. That's controls everything. And so if you have the largest amount of the nervous system, which is the brainstem, in the most movable part of the spine, which is going to be the atlas bone, or what we refer to now as the CCJ, which is the cranial cervical junction. And that's basically where the head attaches to the spine.
Mm-hmm.
If you have the most range of if you have the most movement in this area and the largest bundle of nerve fibers in this area, you can see how
Mm-hmm.
this one bone being misaligned may cause problems from the top all the way down. So, some of the things that we see in the office right now, lots of jaw problems, lots of vertigo and dizzy problems, lots of ear ringing and tinnitus, Meniere's disease. There's whenever I adjust people in the office, one of the very first things that we do is we actually check and we do some connecting into the lower body, into the lower legs. And then we adjust the upper cervical neck and we recheck and we test how the lower body is connected after the correction of the atlas. And 9 times out of 10, when we make that correction, the patients, they notice that their legs work better or they're lighter, and there's different things that work as well too. And so it's connectivity is what it really is. It's connecting the brain to the rest of the body.
Wow. Perfect. Yeah, that's a lot of information, but you know my story and how I ended up coming to see you, and the route that I had to take, which later on in the show I am going to, give it the full testimony as to what prompted me to come to see you. And it was so important for me to get you on here because so many people do not know about upper cervical care. And I have been seeing chiropractors for at least, let's see, I think since somewhere around 2005, I had been seeing chiropractors and had never heard about an upper cervical chiropractor. Although all of my pain and problems were dealing with my cervical spine. So
there's not very many of us. It's like I said, it's kind of a specialty in what it does. There's very few in the state of Texas, and Texas being as large as it is, there's some states that don't have any upper cervical chiropractors actually in the state themselves. My patients, I see anywhere from 30 to 35 people a day. And I would say 3/4 of those patients are driving from an hour and a half or greater a distance to see me as well too. So I've got my farthest patient is flown in from Ireland. And
wow.
And so there's patients that come from all over the state of Texas, because again, just like what you said, and me too. It's me too. I was a patient before I became the doctor. I drove 3 hours to see that first upper cervical chiropractor that I ever saw. And so if you find a healer, if you find a doctor, if you find a mentor, if you find somebody that can take away those physical ailments, you'll drive, you'll go see these people. You obviously just in your testimony can probably, attest for this later. Living with chronic pain in this world is one of the hardest things to do.
Yes, I agree. And even being a medical provider, right, treating patients, one of my specialties was chronic pain when I was practicing. And I had so many patients that I was referring to chiropractic care. But once again, I, even as a medical provider, did not know that there was such a specialty as upper cervical until I had my health crisis. And
Yes,
I
ma'am.
really had to dig deep to find what is the cause of my problem, because it was no longer just the neck pain and the headaches. It was all of these other symptoms that were coming out of the blue that were really ruining my life. And once again, I'll go into the whole story later, but going through the process that I went through and coming to Texas, because where I was in California, I could not find an upper cervical chiropractor when I was looking for one. But I did find a chiropractor that was familiar with upper cervical chiropractors. And he knew that the condition that I was in, I could no longer continue to get regular adjustments because that was making my condition even worse. And so he basically dealt more with myofascial release, more with acupressure,
Right.
stretching my neck and so on. But he absolutely could not do any more adjustments on my neck.
And that's great. Thank you very much. That's something I didn't go into. Upper cervical chiropractic. Another thing, the oldest patient I have in my office, she turns 104 this year.
Oh, wow.
And I adjusted a newborn baby probably 2 or 3 weeks ago. I've got another newborn on the schedule in a couple of weeks. And so with a lot of people are like, whoa, what are you doing taking newborns to chiropractors? Or like, how's the person? Again, the type of adjusting that we do, it's different. There's no twisting, there's no popping. The way the atlas is adjusted, it's just with a tap that just gently taps the bone specifically. And that's the most important. I want to, there's no twist and pop and done with upper cervical chiropractic. It's specific. Each and every patient, when they come in, they get a physical exam, and if they decide if we decide they're a candidate, they go through a 3-dimensional x-ray. And so it's an x-ray, the digital x-ray that we take from the side, it's a digital x-ray that we take from the front, it's a digital x-ray that we actually take from the top down to see exactly in 360 degrees how the head is sitting on the spine. And so there's no guessing. Everybody has their own specific correction, and we take the guesswork out of it, and we know exactly what we need to do to put the bone back in the correct position with the correct vectors. We use an instrument, which is called the Laney instrument, and there's different types of upper cervical that use some different types of instrumentation, and we all have different names for them. But we use an instrument that just delivers a small little tap that just, again, gently moves the bone back into the correct position. And so we can adjust infants, we can adjust 103, 104-year-old people. The specificity and the low force technique that we use is we can treat almost anybody.
Yeah, I was actually blown away when I had my first adjustment, and I thought, is that it?
That's the question you get a lot of times. It's like, oh my gosh, I paid this much money and that's all I'm gonna get, and then the true adjustment kind of kicks in, and we hope everyone gets the correction just like you did as well too.
Yes, absolutely, absolutely. So what are some of the misconceptions about upper cervical chiropractic? What are some of the misconceptions? So people think that you only deal with pain, just chronic pain. What about the other issues that drive people to come in to see you when they're basically at their wits' end, where they've
So,
been diagnosed with this, that, and the other, only to find out it's all coming from the neck?
that's great. That's a compounding question. And number one, I like to think about it like this way. I don't like to deal with pain. I don't like to deal with those things. I don't like to look at those as symptom-based things. What I'm doing is I'm trying to correct a misalignment, and whatever that takes away from you, whatever power we restore, whatever God's healing energy, I like to refer to it as innate intelligence or the Holy Spirit. And we all have the Holy Spirit flowing through us. And when, if there's pressure on a nerve, if there's pressure on an artery, if there's pressure on cerebral spinal fluid, if there's pressure on venous return, these are all going to cause different changes in the body, which all symptoms. These symptoms come in the form of pain. These symptoms come in the form of autoimmune disorders or disease. These come in the forms of MS or trigeminal neuralgia or some of these diseases, Meniere's disease as well too. And so, if you think about it like this, let's talk about this. We talked about 450 million nerves, but let's talk about one. Let's talk about one nerve.
Okay.
Let's pretend this one nerve is a garden hose, and let's say this garden hose, we turn it on at the house, which is the brain, and we're running this hose to the garden. And let's say somebody comes up and they bend or they kink the hose. What's going to happen to the flow of force, the flow of life going to the garden?
It's going to be cut off.
Correct. And so the garden is going to go through, a garden just doesn't die. It goes through symptoms or stages. Unless you live in Texas and it's 125 30 days, it just dies. No, but if it goes through stages, and so the garden will wilt, it'll quit producing fruit and flowers, the leaves will turn brown, it'll go through all of these symptoms before it gets to the end stage ultimately of death. And so the body, as we go through stages in life, and we go through stresses, and we go through traumas, and we're no longer, our body is no longer that same vessel that it once was. And those traumas are causing pressure on certain nerves or certain arteries. And flow is not flowing as well as it once was in the body. Then you can't expect your body to operate as it once did. And so your body will begin to break down and you will begin to go through symptoms. The symptoms start with neck pain. And the neck may turn into a headache, and the headache may turn into jaw pain, and the jaw pain may turn into an autonomic problem or something later on as well too. And so again, you see these symptoms begin to just stack on top of each other, one after another, until we get to the breaking point.
Let's even depression, right?
Ah, yes.
Even depression, because people with chronic pain, that's one of the other issues that they now have to deal with. So now, instead of them seeing one specialist, now they have to see psychiatry or psychologist. And so not only does the symptoms start to pile up, but also the number of doctors and the number of appointments that they're seeing start to pile up, because we're not getting to the root of the problem.
And so you can snowball into that effect of exactly what you're talking about, into multiple doctors, into multiple pills, into, when you look at, and I hate to say this, but, medicine is the third leading cause of death in the United States of America as well too. And, so misdiagnosis, or I'm taking this pill from this doc and this pill from this doc, and they don't know that they're, taking them. And so, again, less is more, my opinion as well too. But, again, with what we have to offer, what upper cervical chiropractic, all I am trying to do in my office is alleviate pressure on the brainstem, which decreases flow from the brain to the rest of the body. And it does not allow the body to operate at 100% the way we were designed. And it's sometimes so simple. it's impossible for some people as well too. Just like, you know, the first adjustment, it's like, man, that's all this guy's going to do. Like just a couple of tests, you know?
Mm-hmm. Because they're expecting this grand, well, especially for people who have been going to see general chiropractors, and you have the pop-in, the crack-in, the snap-in, and so on in multiple levels, right? Not just that one level. Oh, my lower back hurts, so we're going to adjust the lower back. My upper back hurts, we're going to adjust the upper back. Oh, well, also my neck. So these are 3 different areas that are being adjusted. And with you, you adjust that one joint.
It's all connected.
And it's all connected.
It's all connected.
It's not rocket science, right?
Again, you know, again, when you look at the anatomy, when you look at how the body is designed and how it works, you know, again, it is simple. You know, it comes down to getting the head on straight, and you know, everything else flows. You know, it's not just the brainstem. You know, there's vertebral arteries. I don't know if you can see it or not. There's a string. I'll try to get it here. There's a string, and when I turn this, you'll notice that string becomes compromised. It becomes bent, just like that garden hose that we talked about. Now, that's the life force to your brain. That gives blood supply to the brain, the face, the head, and the neck. And so if the brain isn't getting enough blood supply and it needs more blood supply, then the body increases blood pressure. And if the body increases blood pressure and man can't figure out why it's increasing blood pressure, then man's going to stop increasing the blood pressure with medication. But maybe the body was increasing blood pressure for a different reason, to keep the body going. Does that make sense?
That makes plenty of sense, especially since, once again, going into my testimony, that is part of my testimony, right? Of the blood pressure being out of control.
Yes.
And yeah.
And, you know,
the pill's not working.
And well, you know, there's a study, the Marshall-Dickholt study. And, you know, again, there's studies out there. You can find them. But there's a Marshall-Dickholt study that was done years and years ago. And it took 2 medical doctors that were prescribing 2 medications at one time to a patient. And they took them to an upper cervical chiropractor and they got adjusted. And they discovered that one correction from the upper cervical chiropractor decreased the systolic and diastolic blood pressure better than the medical doctors could do with 2 medications at one time.
Absolutely. I can attest to that.
Love it.
So, wow. So we have a question here. Sister Jeanette said, Doctor, do you have a podcast?
I do not.
Doctor, you should have a podcast.
Difficulties we're having tonight. This is not my forte.
But it could be.
Yes.
We will share this. We will definitely share this so that you can get the exposure and so people can get this information, because this is such valuable information. Valuable information.
I want to point some people to a website as well too, and it's not my website, but it's a general upper cervical website. You know, here's the next thing. You know, so people may ask, well, how do I find one of these people? There are lots of chiropractors in this world as well too that they may not broadcast, they may not tell the complete truth in the office. Do they adjust the upper cervical neck? Absolutely they do. But are they an upper cervical specialist, or are they a specific doctor? So, you know, again, I want to point you guys to a couple of sites as well too that you can go and have a little reference and find some good upper cervical doctors as well too. And I don't have a problem if somebody's in need in an area and can't find somebody. I don't have a need helping them find the closest upper cervical doc as well too. So you can always reach out to my office and I'll help you as well.
Fantastic.
But UCC near me, like upper cervical chiropractic near me.com, is a brand new little website that has just come about in the last 3 or 4 months. And that's exactly what they're trying to do is trying to get you to the right upper cervical practitioner that is nearest to you.
Okay, let me try and put that in the chat here for them. UCCnearme.com.
Yes, ma'am.
I just lost my page. Let me see. See if I can put that in here.
And if you can't, no worries. Again, like I said, you can, people can reach out to me. And again, if you search the right things, if you search for upper cervical specific, if you're looking for a chiropractor, those are some of the keywords you're looking for. And then, in general, almost all of your upper cervical chiropractors are going to take some really specific and specialized x-rays of you as well, too.
Yes. I put it in there. Don't forget the www.uccnearme.com. Perfect. Thank you for that information. Do we have any other questions? Sisters, this is the time to ask these questions now that we have Dr. Williams here. So if you have any questions, put them in the chat, or if you want to come on video really quick, but we're going to be respectful of his time. We know that he's busy. Monday is right around the corner. He's got a busy day tomorrow.
We do.
And you have a busy day, I'm sure.
That's okay. Somebody sharing this word with me is what got me where I'm at and here and able to, speak or preach or help, get the word out is part of my calling. It's part of why I'm here as well, too. So
thank you so much. God bless you. Thank you so much. Sister Jeanette says, why would I hear a clicking sound under my ear when I turn my head to the right or left?
So great question. I get this a lot in my office. We have to understand like this, just like automobiles, our body, it gets older, is going to break down and deteriorate a little bit. And so the body is always making a couple of cells while the heart is beating. It's making osteoblasts and osteoclasts. And those two different cells are doing two different jobs. One builds new bone in the body, yes, and chews up old bone. And so when we have an injury or a trauma and there's a misalignment, and the body may build a little bit of scar tissue in the joint. And so as the body is building that scar tissue and you're turning your head or you're using some of the joints, you may be rubbing over some of the calcified tissue, some of the scar tissue that's being built up. And so some of those popping and clickings, there's nothing to worry about. I always tell my patient, if there's popping and clicking with pain, I'm concerned about it and I want you to converse and let's talk about it. A lot of times when I adjust people, they may come back in and say there's popping and clicking after the adjustment. And again, that's simply because we're putting the bone back into the correct socket. And again, the body has built up a little bit of scar tissue over time. And so as the condyles are moving back and forth, it's kind of those osteoclasts are eating up and chewing up some of the bone as well too. So sometimes there's not as big of a deal for some of the popping that and the grinding or the crepitus that is going on. Other times it could mean that things are misaligned. You needed correction. You need to be you need something to be put back in the correct position so there's no more grinding or cracking.
Very good. I hope that helps, Sister Jeanette. And then Sister Johnny says, I was preoccupied for a moment, but did he elaborate on confusion and brain fog?
Okay. So I get, again, brain fog. Usually brain fog is a secondary symptom to other things going on in the body as well too. And this is another thing that I tell all of my patients. You're part of the team. And if you're just coming to me for the adjustment and you're not eating the proper nutrition or you're exercising, or if you're not meditating or praying or taking care of your mind in a healthy manner as well too, then this is only part of the problem. There's other issues, to this problem as well too. And so brain fog, sometimes can come as a secondary effect as well too. But again, if you think about the brain to body connection, I have lots of patients that come in and say, after an adjustment, things are clearer, work better, and so on. So can brain fog be helped with chiropractic? 100% brain fog can be helped with upper cervical chiropractic. And even some chiropractic in general can help with brain fog as well too. But upper cervical chiropractic, in my opinion, definitely gets to the root cause, which is going to be where the head sits on the neck at the most movable joint.
Okay. I have a question in regards to an elderly woman that I am helping out through some issues right now, some medical issues. And one of her major issues is chronic constipation. She has seen upper GI specialists, she's a lower GI specialist, she's seen gastroenterologists. They've ran a multitude of tests on her. However, this constipation she goes for days and she has to have help with evacuating her bowels. With someone that's elderly, if they have a lower back, because at this point we're dealing with osteoarthritis. She has also the brain fog, the neck pain, the some low back pain, but her specialists have not been able to identify what the problem is. She's in and out of the hospital with this constipation issue. And I am encouraging her to get an MRI done of her lower back, X-ray at the minimum, to see if there's maybe even a pinched nerve, herniation, disc herniation, or something that could be causing maybe even a gastroparesis, a slowing down of the bowels. What do you think about that?
I mean, you're absolutely could there absolutely be pressure on a nerve that is just not allowing bowels to evacuate? I mean, that's 100% correct. Go back to that nerve that we were talking about, that bend in that nerve. You know, if there's a misalignment and there's pressure on a nerve, and let's say the nerve goes to the colon, and let's say the information, the communication from the brain to the colon that says, hey, we need to evacuate, we need to go to the bathroom, there's pressure on that nerve, and so the communication isn't getting there correctly, and so the colon can't say we need to evacuate this, and so the body just keeps doing what it's normally doing, right? Until you take the pressure off of the nerve. So infants, newborns, one of the number one things that I see in the off, one of the number one questions that I ask for my infants and newborns is constipation. Because if a baby, one reason that a baby's not going to evacuate is they're in pain, they're sympathetically stimulated. And if they're sympathetically stimulated, you know, again, your fight or flight situation, you're constipated. You don't go to the bathroom, right? And, you know, that's again one of the kids. You can't talk to an infant and ask them if they're in pain or not. And so one of the things that we go through is if there's constipation. And so if the baby is not having bowel movements every day, usually multiple times, a baby's supposed to evacuate after each, you know, feeding kind of type of deal. I'll have kids that'll come into my office a week, 3-5 days before they evacuate. And it's amazing because it's one of the first things that happens when you release the tension and the pressure on the spinal cord is the body works.
Right. Yeah.
Table a lot of times when you're adjusting a baby is they have that immediate evacuation, or the parents come back the next day and they're like, I don't know what you did, but my kid went to the bathroom 5 times last night. And once the body can relax and the parasympathetics kick in and the rest and digest can work and the brain can start to reset the body again, you see the body work correctly. So long story short, to answer your question, can constipation be caused by pressure on a nerve that is simply can be fixed by an adjustment, or can be seen on MRI or something like that? The answer is yes. And I see it more in the beginnings of life and the ends of life.
Ends of life. Thank you. And unfortunately, this woman has been dealing with this for so long, and I just met her, and she's sharing all of this information with me. And I told her, you have to get in with your doctor. You have to get an MRI of your back, an X-ray at the minimum. And they've done everything but that. So everything else has been ruled out. And I said, this seems to me like the most logical thing that's going on. So thank you for confirming that. I'm hoping that she's listening today, because we spoke. I asked you about finding a chiropractor, upper cervical chiropractor in her area. And thank you for sending me that information.
Yes, ma'am.
I appreciate that.
We're all here to help. We're all here to help in this world.
I truly appreciate it. So Sister Jeanette said, thank you for the information. I think I need to see a doctor. I do have pain with the turn-in. And
decreased range of motion. Here's another thing too. If you feel that you can turn your head further to one side than the other side, or there's pain or there's tightness more to one side or the other side, it's simple. There's going to be a misalignment at where the head sits on the spine. And the most important part of the nervous system, the brainstem, is in the exact same junction. And if there's a misalignment there and there's a decrease in range of motion, there's probably going to be something that is not working below it as well. And that could be stomach, heart, lungs, kidney, bladder, all sorts of different organs.
Right. Yeah, those nerves are
important.
They're important. That's why we have how many of them again? They stopped counting at
450 million.
There we go. Let's see. Go ahead, Doc.
That's what I've seen. That's what I've seen anyways.
Wow. Sister Carla said, is there anything diet-wise we need to be aware of that will help us in doing this therapy? Any suggestions?
That's a whole nother podcast. I mean, if you get
right,
that's a whole nother.
Sister Carla, we'll talk about. We've been talking about nutrition.
Yes.
So.
Sugars are horrible. All of your sugars, you've got to stay away from sugar. You have to understand the American diet is an inflammatory diet. You have to, every disease, every autonomic disease here that we have is an inflammatory based stuff. Take out the inflammation, take out the sugars.
Yes. We talked about the SAD diet, the standard American diet, and it has no purpose whatsoever. But like you said, to cause inflammation. So we've been focusing more on the Mediterranean diet.
Beautiful.
That's what we've been focusing on. So I think that's the answer to your question, Sister Carla. We'll stick to the Mediterranean diet because it is anti-inflammatory, and stay away from the SAD diet. Sister Alicia says, can this help a stroke patient, Sister Karama?
Okay, so another
lack of circulation on my right side.
Another great question. As an upper cervical chiropractor, again, who do we see? Who can we treat? I'm one of the few chiropractors in San Antonio that you can still come and see if you've had surgery to the majority of your spine, because the adjusting that we do is different. It's not hard. We're not twisting. We're not popping. So as long as the atlas is not fused to the C2, the second cervical vertebrae, or the occiput, which is the base of the head, we can adjust you, even if you've had your neck fused at 5, 6, 6, 7, which there are too many of those surgeries going on in this world.
Oh my gosh.
But we are one of the few people that can treat and adjust because of this. So, and again, stroke type patients, if you go to general type chiropractors, they're going to twist, crack, pop. A lot of them are going to see that case. And number one, they're going to walk away from it or not going to want to treat it correctly because of the prior conditions that are there as well too. I have several stroke patients in my office, and I've absolutely seen all of the majority of my stroke patients. Usually we see a little bit more improvement in, and it may only be 5 or 10 or 20%, but in somebody that's lost something, 5 or 10 or 20%, again, improvement is sometimes what we're looking for. So just
Wow.
yes, there are certain stroke cases. Now, again, not all stroke cases are treatable. Again, there's each one would have to be evaluated and looked at and done a complete exam on. But do I have people in my office that have suffered strokes that are in my office that are continuing to get better? Yes. The answer is yes.
Perfect. That's wonderful. That's wonderful news, Sister Karama. Yes, please look for an upper cervical chiropractor in your area. Yes. Sister Carla said, wow, this is really such good information. I agree. This has been wonderful. Wow. We will have to have you back on here again, Dr. Williams.
It'd be my pleasure.
Thank you so very much. Thank you so very much. Oh, another question real quick. Can UCC, can upper cervical chiropractic help with seizures? That's a great question.
Yes, the long answer to, I was just trying to think if I I'm trying to think if I've got a couple of YouTube videos on a couple of seizure cases that I had, or if they were just written cases that kind of wrote in. But there's lots of different seizures in this world. There's a certain one that's called idiopathic, which if the terms of idiopathic basically means cause unknown. And so the medical community is labelizing certain types of seizures as cause unknown, meaning they don't know what is causing them. So again, if I am labeled with anything idiopathic, I'm going to go look for advice somewhere else because that person is telling me they don't know what's going on.
Just the name alone tells you it's idiopathic.
Correct. But we absolutely, I see it more in younger kids than I do full-blown adults. But yes, we have stopped seizures on people. I've actually stopped seizures in the office, adjusting people while they've been having them at that point in time. There's actually been patients that have been carried into my office having a full-blown seizure, and we've got them on the table and got them adjusted, and the seizure stopped.
Wow, this is so awesome. Sister Jeanette says, Sister Zion says, I hope you come back, part 2, nutrition. So that would be wonderful. Sister Jeanette says, what a gem of a human being. Thank you for your time, doctor. Sister Carla said, thanks for your time, doctor. We thank you so, so much, Dr. Williams. I so appreciate you.
Pleasure being here.
Thank God for you. I will be seeing you on Thursday.
I look forward to it. Y'all have a great evening. Enjoy the rest of your evening. And thank you very much for having me on. And
thank you.
Everybody, continue to take care of that neck and spine, and, just keep moving in a better direction in this world.
Thank you so much. It was such a pleasure to have you.
Y'all have a great evening.
Good night.
Bye-bye.
Bye-bye. Wow. Was that not awesome? Wow. So much information. Isn't that absolutely amazing? Isn't that amazing? And now you all have the website address in order to find an upper cervical chiropractor in your area, no matter what situation you are dealing with. If it's an autoimmune disorder, if it's low back pain, neck pain, high blood pressure, whatever the case may be, it is definitely worth getting an evaluation from an upper cervical chiropractor to see if there's something that they can do to help. Because like I said, I am going to talk tonight about what prompted me to even end up under the care of Dr. Williams. Oh, Sister Karma says, I love all of your plants, Aqua. Tawada, there's some back there that you're not even able to see. But yeah, we're zooming in and out again, aren't we? This camera, it just does its own thing. So I just leave it alone anymore and let it just do its own thing. So I'm going to take just a couple of minutes break to do some adjustment on these lights. This light just came on really, really bright in my face and just decided to do its own thing as well. So I'm just going to take a brief break just to adjust the light in. And then I'm going to come back and we are going to go into my testimony about, like I said, my health crisis that landed me under the care of this incredible human being, as you said, this incredible doctor and human being. He is so incredible. So we'll talk about that in just a minute. Give me a couple of minutes to do some adjustments. I'll be right back.
Hebrew royalty. She's got the fruits of the spirit, love, joy, and peace. She's got long suffering, gentleness, and goodness, endurance, faith, and meekness too. Hebrew royalty. She's got the fruits of the spirit. Hebrew royalty. She's got the fruits of the spirit, love, joy, and peace. She's got long suffering, gentleness, and goodness, endurance.
All right, we are back. We are back. So before going into the testimony, what is your cup of tea? Let's talk. What is your cup of tea? Because like I said, we really wanted to just be respectful and mindful of Dr. Williams's time. So I wanted him to come on and give us all of that good information first. And now we can jump into tea time. So let's jump back in. What is your cup of tea tonight? Because of course, tea time with Hebrew royalty will not be tea time if there was no tea. My cup of tea tonight is actually kind of a fusion. It's a fusion of lavender tea and lemons. So I kind of made a lemonade kind of tea kind of fusion. So it's lavender lemonade tea. How is that? Lavender lemonade tea. So we're going to watch just a very short video of lavender lemonade to get rid of headaches and anxiety. This video is by Healthy Holistic Living. Sister Jeanette says, I'm going to have lavender tea harvested from my garden. You know, sis, I cannot wait to get my greenhouse. I am actually purchasing a greenhouse so that I can start getting all of my herbs planted. I just don't want to put them in the ground. I'm looking to get a greenhouse and start planting all of my herbs. But what I have is my lavender lemonade tea fusion. Let us look at this very short video. It's only like a minute. So let's take a look at this real quick.
Healthy holistic living. Quick tips. Let's make lavender lemonade and get rid of headaches and anxiety. This is what you are going to need. 1 cup of raw honey, 5 cups of pure water, 1/4 cup of dried, organic, and culinary lavender, or 1 drop lavender essential oil, 6 lemons, peeled and juiced, lavender sprigs for garnish. Pour half the water in a pan, bring to boil and remove from heat. Add honey and dried lavender. Let steep for approximately 20 minutes. Strain the mixture and pour into larger container. Add lemon juice and the remaining water. Stir well. Add the sprig of lavender and enjoy your drink. For more quick tips, follow us on Facebook and visit our website. We are looking forward to seeing you. Healthy holistic living.
So that was lavender lemonade to get rid of headaches and anxiety by Healthy Holistic Living. So yeah, this tea fusion, tea/lemonade fusion is so delicious. Oh my goodness gracious. I think it's definitely one of my favorites because I can drink it cold. That's with any tea, right? Cold or hot, or even room temperature, and it's still super delicious. And it's calming, and of course, it's good for the gut. All right, that being said, let us talk about my journey on how I got here and how I ended up under the care of Dr. Williams. So I am going to go back to 2021. I'm going back to, is it by Ticino, Sister Johnny says? No, it's not. It's actually, I used the lavender flowers. I used the lavender flowers and I put them in my tea. I used my tea infuser and infused the tea with the lavender flowers. I added the lemons. And in this one, I added some sugar, which normally I would use honey, but this batch that I have, I actually use some organic sugar. But you can just add some honey, and it's just absolutely delicious. But get some organic lavender flowers, and you can just boil it as a tea. And then add the lemon and sweetener if you want any sweetener. It's really delicious even without the sweetener, just because of the flavor of the lavender. But yes, let us go back to December of 2021. That's where things went haywire for me. Let me just put it that way. December of 2021. Looking back before December of 2021, going back about a year prior, I was having some of these symptoms that I'm going to talk to you about, that I'm going to explain. But it was so sporadic, and I really did. I ignored them because they would just come and go away. But in December of 2021, I was actually working from home. We were going through the whole pandemic thing, and I had walked away from my full-time job as a physician assistant, PA, and I cut down my hours to 3 days a week doing telehealth. And at that point, I was working in psychiatry, but I was behind my computer all day on two screens, kind of looking back and forth. And I had a patient that I was seeing this patient on telehealth, and he started telling me, he said, wow, he said, I've never had a doctor like you that really takes so much time with me and to explain everything and you know, to put the care that you put in with me as a patient. And he said he's never had that experience. And I said to him, I said, you know, I don't know how much longer I'm going to be doing this. This was somewhere around the middle of December. I said, I don't know how much longer I'm going to be doing this. I said, because I really believe that the Most High is moving me in a whole different direction. I don't know what it is. I said, but this is not my gift. I said, anyone can go to school and learn how to prescribe medications. I said, but prescribing medications is not my gift. I said, my gift is more in counseling and teaching. And I said, I believe that the Most High is moving me in a whole other direction. And at this point, I was not really even thinking about, you know, I knew, let me just backtrack a bit. I knew that I was no longer comfortable doing the type of work that I was doing as a physician assistant, prescribing meds, and what used to be so rewarding, the career that used to be so very rewarding to me was now not so much, because I had started looking at things differently, looking at things more from a holistic standpoint. And I just knew that God was moving me in a whole other direction. Where I was going, I didn't know when I made that statement. So shortly after that, I would say maybe 2 weeks after, because right at the end of December, that's when everything went haywire. About 2 weeks after I made this statement to my patient, I had always had neck pain, severe headaches for many, many years. Like I mentioned earlier, it was 2005 or even earlier when I started seeing a chiropractor for my neck pain, having been in the military for as long as I was, and, you know, carrying certain things that you have to carry on your back, and, you know, heavy backpacks, rucksacks, weapons, all of that you have to carry on your back. And I did that for so many years. When I left the military, I just suffered from chronic neck pain and headaches. And I was diagnosed with moderate to severe degenerative disc disease in my cervical spine, in my neck. So the headaches and neck pain came along with that. And I had been seeing chiropractors consistently for many, many years. However, come December of 2021, everything just intensified. The headaches got worse. The neck pain was excruciating. When I got off work, all I could do was lay. Sometimes I wouldn't even make it to my bed. I would just walk away from my computer and lay on my couch, and I would cry. I would cry because the pain was so intense. And I personally hate taking medications. So even ibuprofen was something that I would have to take only as a very last resort. So I relied on my chiropractic treatments. And what I noticed is that my chiropractic treatments were now becoming more frequent. Instead of once a month, I started going every other week. And then I got to the point where I was needing an adjustment every week to help to alleviate the pain. But now it was no longer just the pain. Suddenly, out of the blue, I started having intense palpitations. My heart just started racing out of the blue. There were some Shabbats, some Saturdays I would go to church and I'm sitting and I'm reading my Bible and my head is down like this. And my heart would just start racing. And sometimes I felt like I was just going to pass out and I didn't know what was going on. I would get up and go outside, walk, get some fresh air. And so, like I said, in December, everything just went haywire. My heart rate was going up to about 160 something, 65 beats a minute. And it got to the point where I could not even walk around in my house. I was crawling on all fours from one room to the next to get around, because every time I moved a certain way, my heart rate would go up, and then my blood pressure started going out of the roof. And this led to multiple ER visits to try to figure out why suddenly is my heart rate 160 something beats a minute. Why suddenly is my blood pressure out of control? So long story short, I had 15 ER visits within a couple of months. And during these ER visits, all that they could do was, okay, here's some blood pressure medication to bring your blood pressure down. I was tried on so many different medications. I was going to my VA doctor. These blood pressure medications, instead of making things better, everything got worse, to the point where even my breathing, I was placed on beta blockers, which is supposed to bring my heart rate down, but it was not just reducing my heart rate, it was reducing my respiration. So now I'm having difficulty breathing. I couldn't walk across the room in my house without being short of breath. I had to stop driving. And the reason I had to stop driving was because every time I turned my head to the left side to look in my rear view mirror, I would nearly pass out behind the wheel. So driving became dangerous, not just for myself, but of course, if I pass out behind the wheel, imagine what kind of tragedy that could cause. And so I couldn't drive. I could no longer drive. So my whole life was turned upside down. I couldn't walk around in my house. My blood pressure was out the roof. My heart rate was out of the roof. My breathing was, I was having so much difficulty breathing. Everything went haywire. Then I started having numbness and tingling in my legs. I'm nearly passing out. And I'm still going to see my chiropractor because the headaches were so excruciating. The neck pain was so intense. And I was going to see my regular chiropractors, and they kept popping my neck, cracking my neck. And it got to the point where I saw one chiropractor, and when he did my adjustment, The sound was so loud. Oh my gosh, when he cracked my neck, it was so loud. And at this point, there were two sisters from the church that were taking turns coming to my house and staying with me. Praise the Most High for these sisters. They took turns with helping me around the house, feeding me. There was a point where just sitting up was causing my heart rate to go out the roof. So I would lay down to reduce the heart rate and find different positions to be comfortable. And so two of the sisters, Sister Sarah, Sister Madakwa, took turns coming to the house and staying with me, taking me to the hospital when I needed to go to the hospital. But long story short, nothing that was being done was helping my condition. The medications were not helping. I was tried on multiple medications and nothing was helping. I had seen a cardiologist. The cardiologist says, this is not a cardiology problem. We don't know what this is. This is not a cardiology problem. I know your heart rate is out the roof. However, your heart rate, your heart rhythm is, you have a normal rhythm, although your heart is beating fast. They could not figure it out. I had CAT scans of my head, MRIs of my neck, and my neck showed severe degenerative disc disease, severe arthritis. And I decided these medications that are being prescribed are not helping me. As a matter of fact, they're making me worse. And I weaned myself off of the medications because I told my doctor, I said, I need to find the root of my problem and fix this problem. What we're doing here is putting a Band-Aid on it and it's not working. So I said, I am going to do for myself what I've done for my patients. And I've always been of the mindset that I need to find the root of the problem and not just put a Band-Aid on the situation. And I would just lay in my bed and I would just pray. And what I kept telling the Most High is, your plan is always perfect. I don't know what you're doing, but I know that it is perfect. And that's all I kept telling him. I said, I know your plan is perfect. And I trust you. And I just kept praying and asking the Most High to show me what this was all about. What are you showing me? And what came out of that is that the Most High was really weaning me off the respirator, which was my job. That was the respirator that I was on, is my job. And he was weaning me off of that. And he showed me how he brought me from 5 days a week down to 3 days a week, down to now not working at all. But I knew at this point that the Most High was showing me that I could not go back to what I was doing. I could not go back to the job that I was doing, the way that I was what I was doing. He showed me, and the way he showed me was the fact that I now was taking medications that I used to prescribe to others. And he allowed me to see what some of these medications do, what some of the side effects to these medications can be. And at that point, I said, oh, wow, I cannot go back to doing what I was doing. And I said, well, what do I do now? Well, at this stage, I couldn't work. I couldn't drive. So all I could do was depend on the Most High. And that's what I did. And I just started praying and asking the Most High to show me what this problem is that I have. How do I fix it? What is this? Because having been a medical provider, like I said before, dealing with chronic pain, dealing with patients with depression, anxiety, and so on and so forth, I knew I wasn't depressed. I knew that. My VA doctor was trying to convince me that what I was having was panic attacks. And I said, I've worked in psychiatry. I know what panic attacks are. I said, I'm not afraid to do this or do that. And I said, the heart rate goes up whenever I move a certain way. And I woke up one Saturday morning on the Shabbat, and what came into my spirit was look up cervical neuralgia. And I said, So I went online. I actually just went on my phone and I looked up cervical neuralgia. And when I looked that up, which cervical neuralgia is nerve pain in the neck. It's just a general term of nerve pain in the neck. And when I looked it up, the rabbit hole that I went down, because there were so many different sites that I went to, okay, cervical neuralgia, this, that, and the other, the definition and so on. And then it took me to this website. And when I went on that website, every single thing became so very clear that day as to what my condition was. When I started reading what was on this website, and I started watching videos of the testimonials of people that had the same symptoms that I had, where their blood pressures were out of the roof, where they were having these palpitations, they were diagnosed with high blood pressure, they had multiple ER visits. I remember one person said that they had about 100 ER visits and they still didn't know what the problem was. They were started on the very same medications that I was started on. They were told, oh, you're experiencing panic attacks. You need to see a psychiatrist. They went through all of that. They went to the cardiologist, just like I did. They had all of these tests ran and still no answers until they did exactly what I did. And they found through this website or through YouTube or what have you, this doctor in Florida. And so this website that I went to was of a clinic in Florida. And what I'm going to do is I'm going to pull up the website of this clinic, because like I said, I woke up that morning and it came into my spirit, look up cervical neuralgia. And I'm going to bring this website up because so many of the things that Dr. Williams just said, you're going to see that on this website, so many of those symptoms, so many of the things that he said is going to make sense when you take a look at this website. So this is, the website appears to have changed since I saw it back in early 2022. It's changed, but the information is still the same. So it is neck pain and cervical instability. So what I learned is that this was the condition that I was dealing with, is actually a condition called cervical instability. And this clinic in Florida happens to specialize in treating people with this condition. So it says here, it says very few clinics in the world specialize in regenerative treatments for painful neck conditions and cervical spine instability. It says Karen Medical is one of them. These cases are among those that we are the most passionate about, in part because the transformations we see in our patients are often nothing short of awesome. Conditions such as post-whiplash, post-concussion, and radiculopathy can devastate a person's ability to work and function normally, and that's where I was. However, they typically respond beautifully to just a few prolotherapy treatments. Our providers work with patients to carefully detail the extent of the instability through motion imaging and determine which prolotherapy solutions, as well as other cervical stabilizing and realignment techniques, will offer the best chance at permanently alleviating pain and other symptoms. Whether you have recently been in an auto accident or experiencing symptoms or have struggled with neck pain for years and want to find a more curative treatment and avoid cervical fusion surgery, which is where I was headed, our specialists can help. And so it goes into symptoms caused by cervical instability. And here are some of the symptoms: anxiety, balance difficulty, cognitive impairment, you can't think right, crepitation, which is that grinding sound in your neck, difficulty sleeping, dizziness, drop attacks. This is where I started. I wasn't actually falling out yet, but I was getting close to that, where I would just have near what they call near syncope, which is near fainting episodes, dysphagia, which is difficulty swallowing, ear pain, fatigue, feel the need to crack the neck. And I was constantly cracking my neck, headaches, inability to hold an adjustment. And this is what I talked about earlier, where my adjustments were no longer lasting a month. They were no longer lasting 2 weeks. I was now having to get adjustments every week. Irritability, lightheadedness, memory problems, migraines, which, wow, like I said, the intense migraines, the intense headaches, muscle tightness and spasms, nausea, vomiting, neck pain, stiffness, soreness, paresthesias, which is the numbness and tingling, radiating pain into arms or shoulders, speech disturbances, temporary relief with a neck brace. I had now been wearing a neck brace. Tinnitus, which is ringing in the ears. I still have the tinnitus. That hasn't gone away yet. Vertigo and visual disturbances. So those are some of the symptoms of cervical instability. And as you can see, a lot of these symptoms may be, they appear so general, right? Ear pain. Who would think, okay, ear pain has something to do with my neck, right? And so it talks about the whole body effects of cervical instability. It says cervical instability can influence the nervous system of the whole body and thus every tissue, just like Dr. Williams was saying. Look at all of these nerves that we have that are coming out of the brain, the neck area, right? All of these nerves that go to every part of the body. And imagine if your neck is, if the muscles, tendons, and ligaments of your neck are weak and they're not able to stabilize your spine, whenever you move a certain way, that can cause a pinching on the nerves, and it can also cause a pinching of one of the blood vessels, hence the blood pressure issues, hence the heart rate going up. the nerve pain, the headaches, the migraines, right? The near fainting because not enough blood flow to the brain. So it says here, the ligaments that hold the cervical vertebrae in alignment can be damaged via a sudden trauma, such as a whiplash. And I did have a whiplash in late November, or concussion, or through the slow stretching of ligaments known as creep. This can be attributed to extended hours of poor posture in front of a computer, which is what I was doing. Hours on my computer working, doing telehealth, or smartphone, or other positions that slowly stretches the ligaments. Cervical instability causes the facet joints to move too much, and this can cause pinched nerves, headaches, vertigo, and drop attacks, among other symptoms. The movement can clearly be seen by using digital motion X-ray. And so this was one of the tests that I needed, that because my doctor at the time, he was not buying it. He did not believe that this was the condition that I had, so absolutely refused to do the digital motion X-rays for me. However, I'll go into how I ended up getting the treatment. So it says here, it allows the practitioner and the patient to observe the vertebrae movement as the patient moves his or her neck through the full range of motion. DMX is an excellent tool for assistance to diagnose the problem, and is often recommended for patients instead of a static X-ray or MRI, which is what was done on me, were X-rays and MRIs. I never did get the digital motion X-ray to definitively diagnose me with cervical instability. Motion studies and physical exams indicate to the prolotherapist which areas are causing the patient's symptoms and direct the course of treatment. So let's see what else it says here. This talks about the digital motion X-ray of the neck, but we see where this is going. So when I read this, I thought, oh my gosh, oh my goodness, this is definitely what I'm dealing with. So I reached out to Karen Medical. I reached out to this clinic in Florida. And once again, remember, this was during the time of COVID. So there was so much going on during that time. And what I was told, the treatments were pretty pricey. The prolotherapy and PRP, which is protein-rich plasma, and we'll go into that. But long story short, when I reached out to the clinic in Florida, it was definitely not, I couldn't afford the treatments, number one. Number two, I would have to go to Florida every 6 weeks to have the treatment. So imagine flying every 6 weeks during COVID, staying in a hotel, getting the treatments every 6 weeks. That was not going to work for me. So what I did was I started looking for someone in California, in my area, that provided the treatment, which is what this clinic talked about, was prolotherapy, where it's an injection that they put in whatever area is damaged. It doesn't have to be just the neck. It can be the lower back. It can be the knees, whatever joint is damaged. And I'm not going to go too deep into that treatment just because I'm not a prolotherapist, but however, it's a dextro solution that is injected into those areas, or a sugar type solution that is injected into those areas that helps to heal and strengthen those ligaments that are damaged. And so I started looking for someone in my area, and thank the Most High, I found a doctor in Santa Monica that he did a Zoom assessment on me, and I sent him all of my x-rays and my MRIs, and we had an assessment, and he basically said, of course, because we don't have the digital motion x-ray, I can't say definitively that this is what it is, but your symptoms are, pretty spot on. So what I will need you to do is come into the office in Santa Monica. And I flew with the assistance of one of my sisters. Sister Sarah flew with me to Santa Monica. At that point, I was in a wheelchair. I could not even walk through the airport. I was in a wheelchair because if I stood up, I couldn't walk from here to there without being short of breath. I couldn't walk from here to there without my heart rate being out the roof. So long story short, when he did the assessment, he said, yes, you are definitely a candidate for this treatment, which is, we started off with the prolotherapy, which is the dextrose solution. He recommended at that point that I get 6 injections, 6 weeks apart. And I had the first injection and went back home. And I started noticing, oh my gosh, I'm really starting to feel better. And 6 weeks later, I went back to the clinic for my second injection, and he was amazed at the improvement. And he said, okay, this time what we're going to do is we're going to not just do the prolotherapy, but we will do what's called PRP, which is protein-rich plasma. And what he did was he drew my own blood and spun it down and took my own plasma and re-injected my plasma into the structures of my neck, the ligaments. And wow, I've had 2 treatments total. At that point, I wasn't working. I really could not afford to do 6 treatments. However, this was the result of 2 treatments of the PRP, the prolotherapy first and the PRP. After that, I realized that I could no longer undergo the general chiropractic treatments. I could no longer have my neck cracked and popped and snapped. And so during this whole process, that's when I learned about upper cervical chiropractic care. And I searched for an upper cervical chiropractor in my area, was not able to find someone that specialized in upper cervical chiropractic. However, I found a doctor in Fairfield, close to where I was in California, Dr. Mann of Heal and Man Chiropractic. And he is the chiropractor that I mentioned earlier in California, that he was very familiar with the condition, and he knew that I could never have general chiropractic treatments again. That is something that I cannot do, at least not on my neck. And so he started treating me with myofascial release, along with he was also working in between my prolotherapy and PRP treatments. And just between those two treatments, I became functional again. I have not been on any blood pressure medications, have not been, as you can see, I'm healthy. I've had no near fainting spells. I'm able to drive. Do I have neck pain? Yes, I do. Are they anything like before? No, they are not. So when I left California, I continued to see Dr. Mann for about a year. And then when I moved to California, moved to Texas, one of the very first things on my list was to find an upper cervical chiropractor to continue my treatments, to continue my care. And that is how I found Dr. Williams. And now I see Dr. Williams every other week. Every other week, the goal is eventually once a month. But right now I'm seeing him every other week for my adjustments. And what a difference my life, what a difference in my life. Once I found the root of my problem. Because before, like I said, dealing with the medications and so on was not even, it was not even a Band-Aid because it wasn't doing anything. My condition just kept getting worse. And to be able to find the actual root cause of my problem and to address that root and to find out that I can use my body to heal my body, using my own plasma to heal my neck. Oh my gosh, Sister Jeanette says, finding the root of your problem must feel like such a relief for you, sis. Con, otherwise you're just chasing your tail, So all praises to the Most High, yes. And the Most High, like I said, he is so strategic in everything that he does. When that situation happened, it was really to wake me up. It was to wake me up out of the stupor that I was in when it came to my job, and to realize that what used to work for me doesn't work anymore. And if it doesn't work for me, then I don't work for it. And so the Most High really needed to do, he needed to allow something drastic to happen, because I do love treating patients. This is what I've done all my life. And you all know my history of, starting out at 5 years old, going to work with my mother in when she worked at the hospital, and then becoming a candy striper in high school, working in the hospitals in high school, and then becoming an Army medic, and then a prison nurse, and from a prison nurse went to Stanford and did my training for PA, became a physician assistant, and I worked as a physician assistant for almost 26 years. So this has been my life. And so the Most High needed to allow something drastic to show me my new purpose. And while I was laying there, and I kept praying and asking the Most High to show me what is your will, what is your plan for my life at this stage. And this Tea Time with Shebrew Royalty is one of the things that was birthed out of all of that pain. This was birthed out of that. And the Most High has shown me that this platform is to be used to help sisters, to help heal our nation. That's what this platform is supposed to do. That is why he moved me out of that position, and he's allowing me now to use all of those experiences that I've had to be able to help others. And so that's why this is so important to me. This is so important to me, because this isn't something that I just dreamed up, that I just decided, oh, one day that this is what I'm going to do. The Most High showed me this, and it's so amazing. It's so amazing when you're walking in purpose, when you are doing what you believe is the will of the Most High for your life. And I do believe that this platform is to be used for situations such as this, to get doctors such as Dr. Williams on here, to get our holistic providers on here, to learn nutrition, to learn how to heal our bodies with the tools, with the herbs, with all of the things that the Most High has provided for us to be able to live longer, healthier lives. And so I thank and praise the Most High for this platform. I thank and praise the Most High for you all. I thank and praise the Most High for people like Dr. Williams, like Dr. Mann, like Dr. Peter Fields, who became part of my healing journey, because the Most High used them as vessels, because they were willing to be used as vessels. And so that's what this platform is about, is to find, for us to explore together how we can live longer, healthier lives. That being said, that is my that's my testimony. I have one other article that I want to show you all to show you about this cervical instability and what it can do. It says here, can cervical spine instability cause cardiovascular-like attacks, heart palpitations, and blood pressure problems? These are the symptoms that I was having. These are the symptoms when I told my doctor at the time, I have cervical spine instability. That's why my blood pressure is up, why I'm having these heart palpitations. And nah, that's not the problem. He even wrote that in my chart. And here we go, right here. It says here by Dr. Ross Hauser, in this article, we will discover how chest pain, a racing heartbeat, panic attack, fainting, and near fainting episodes. These are the symptoms that I was having. And anxiety may be coming from a problem in the cervical spine, causing compression on the nerves, arteries, and veins that are all part of the cardiovascular system. It is important to realize that this may only be one possible explanation as to why seemingly healthy individuals having been checked out by their cardiologists have cardiovascular type symptoms with no clear explanation. That was me. It says cervical instability creates autonomic myopathy or autonomic neuropathy, which is nerve damage that blocks or interferes with the messages sent between the brain and the heart and blood vessels. Can lead to a variety of serious symptoms, including palpitations, racing or skipping beats, tremors, blurring of vision. I had blurry visions, I also had cataracts at the time as well. Lightheadedness, pre-syncope, which is sensation of going to faint. That's what I was having. Even in church, I was nearly passing out in church. Actually fainting, shortness of breath, chest pain. There's a shortness of breath, chest pain, congestive heart failure. I praise the Most High that was not my issue. And various heart arrhythmias. Diagnoses such as myocardial ischemia, angina, atrial fibrillation, ventricular tachycardia, mitral valve prolapse, postural orthostatic tachycardia syndrome or POTS, drop attacks, and life-threatening hypotensive, which is low blood pressure episodes, can be from autonomic failure, which can have a cervical structure etiology. So this article went into so much information. It said a lot of diagnoses, a lot of misunderstandings, cardiovascular-like attacks, heart palpitations, and blood pressure problems. This was me. This was me to the T. And because I wouldn't give up, and I would not accept a symptom as a diagnosis, because I knew that I needed to be properly diagnosed, and I fought for myself to make sure that I was properly diagnosed. And through the Most High, only through the Spirit of the Most High was I able to make this diagnosis on myself. My doctors were not able to make this diagnosis. It was through the Most High. And it was because of prayer, because of actually seeking to get the answer. And that's, if I don't leave anything else with you all tonight, if you are dealing with any issues whatsoever, do not stop until you get to the root of the problem. Never accept a symptom as a diagnosis. Never. Get to the root of the problem and fix it. Fix the problem. Otherwise, you won't heal. Otherwise, you will not heal. You have to get to the actual root of the problem in order to heal. And so that's where I'm at today. I am on the path to healing. Praise the Most High. Wow. What more is there to say? Sister Johnny says, awesome testimony. Says you've been through a dark time, but the Most High brought you through. Absolutely. Absolutely. He always does. And like I said, everything is strategic, right? His plan was to bring me through, not to let me. I knew that it was not his will for me to die in that situation. I knew that. But I knew there was also a lesson that needed to be learned. And so I sought that lesson. And through that, I am now able to help others, right? Through my experience, I can now use my experience to help others. Sister Carla says, come on through, Benjamite Khan. All praises for the fight you fought on your own behalf. All praises to the great I am. Khan, the Most High, I am that I am. Yes. So that is my testimony. Wow. What an intro to April. Alternative and Complementary Therapies and Treatment Month. What an intro, right? Here on Tea Time with Shebrew Royalty. So who's ready for more of this kind of material this month? Who's ready? Who is ready to learn how to live healthier and more productive lives by allowing our body to heal itself the way the Most High intended it to do? Who's ready for that? I know I am. So these are the things that we're going to embark on this month. We're going to embark on these things. How do we get this body to heal itself? How do we use the herbs, the foods, the vegetables? How do we use these things to help us heal? Sister Esther says, I am. Sister Carla, I am. Me too. So next week's show is promised to be another exciting and information-packed broadcast. Be prepared for next week. We will be welcoming a very special sister, a very special guest, one of our very own sisters in Yashaya, in Christ, Sister Patricia, who is a fitness instructor, a colon hydrotherapist, a certified holistic health and life coach, and certified supplement specialist. Sister Patricia is going to be on next week as our special guest, and she will be educating us on colon hydrotherapy. You really don't want to miss next week's show. As a matter of fact, you don't want to miss any of Tea Time with Shebrew Royalties shows. You don't want to miss any shows. And for those of you, if this is your first show, please go back and watch our previous shows. Please go back and get caught up. So invite others to show up next week. Let us give our sister a great showing. Let her know how much we appreciate her taking time out of her busy schedule to be here with us. And I promise you won't be disappointed. Also, come prepared to ask questions. And please don't be shy. Come on video. Come on video and ask questions. You know, it's good to chat, but it's so much better when we talk face to face, so we can put a face to the questions, right? So sisters, I hope that you found the information that was presented tonight useful. Once again, we want to thank Dr. Williams for such an amazing presentation, for so much information. It was a lot of information to unpack, but it was so good. Sister Carla said, that sounds like it's going to be fire. Yes, it will. Yes, it will. And she is so amazing. Wait until you meet her. Wait until you meet her. She is so amazing. So, wow. Whew. So if you really enjoyed this show, please do me a favor and share this video with your sister friends, your relatives, right? Let's grow this channel so that this information can reach Hebrews throughout the four corners of the earth. And even those who are not Hebrews, right, but are willing to be a part of our community. We are to let our light shine so that others can be led to the source of the light. And that's why we give our testimonies, because it's not about us. It really isn't about us, you know? We need to get off of this belief that anything is about us. It's not about us. It's about the Most High, right? So in these times, we really need to talk about all of the wonderful things that he's done for us, all of the things that he's brought us through. So, you know, I am really enjoying these shows. I thank you all for being here. Let us continue to learn and grow. Continue to learn and grow, right? And heal. That's what we need to do. We need to heal mind, body, spirit. So I thank you all and always appreciate you all taking time out of your very busy schedules to have tea and conversation with me. Thawada, thank you for your support. I love you all so much. I love you all so much. Just shared PRP and prolotherapy with my brother. by the way, let me put the link to this. Let me put the link in here to this website. Karen Medical. So although they're in Florida, their website gives you a multitude of information about how prolotherapy and PRP can be used to help heal you. And like, you know, go to that website and get the information and look for a prolotherapist in your area if you think that based on the information that you find here, that, you know, it can help you. I really think that it's worth looking into. I love you all so much. Love you all so very much. Oh, Ayanda Bar, Sister Esther, Sister Jeanette, the water. So, wow. Know that I'm praying for you. I'm praying for us. So until the Most High brings us back together again, may you prosper and be in good health. And remember, true healing begins inwardly before it is expressed outwardly, right? Starts from within. Starts from within. So, how about we plan to see each other next week, if it be the Most High's will? I love you all. And Sister Karama, call me. Let's talk. Sister Karama, call me. Let us talk. Okay? I love you all so very much. Have a blessed night. Shalawam. Shalawam.